guys, it's Khaki. Today I'd like to talk to you about some common and sometimes serious mistakes that bariatric patients make with vitamins after surgery. Let's talk about it. Number one is stopping taking vitamins because you feel good. I don't feel bad. I don't feel like I have any problems. You've lost weight. You are off of a lot of your regular medicine that you were on before surgery. So, I feel good. Don't want to have to take anything. Big problem, big mistake. Many vitamin deficiencies do not develop until years after surgery. Other vitamin deficiencies that are very common can not make you feel bad until you're in a really bad situation. I recently had a patient who was a bariatric post op patient about 5 years out, had been floating along doing really well, all of a sudden didn't feel so well and had a serious iron deficiency that required iron infusions. So just know, no matter how far out you are from surgery or how good you feel, you need to continue to take your vitamins. Another common mistake that I see in bariatric patients is taking regular vitamins instead of bariatric vitamins. We, as bariatric patients, need specialized bariatric vitamins for many reasons. But number one, due to the alteration in our gastrointestinal system, regular vitamins do not absorb. We don't have as much stomach acid because we have less stomach tissue for those vitamins to come in contact with. So the gel caps or the capsule that is covering the vitamin need stomach acid to dissolve so that those vitamins are released. In regular vitamins, bariatric vitamins are formulated not to need that amount of stomach acid. So you could be taking your vitamins faithfully, but if they're regular vitamins, sometimes they don't dissolve and you never actually get those vitamins. Another reason is due to our altered absorption, we need megadoses of specific vitamins that you don't get in regular vitamins that are not specific for bariatrics. Another common issue that I see is not taking iron. Unless there is a reason to not take iron, unless your healthcare provider has told you not to, the normal specific guidelines after a bariatric surgery, especially in menstruating women, is to be sure to get an iron supplement. Many of us have iron deficiencies before we have surgery. Throw in the fact that the absorption is altered, so you may not be absorbing the protein that you're taking in, and then the fact that you're eating less. It's a recipe for disaster unless you get a supplement in. Another thing that I see often is taking calcium and iron at the same time. Now, there is some new data on this that in some patients, taking at the same time isn't as big of an issue as we thought it was in everybody, but in most people, calcium and iron, when taken together, basically fight each other out for absorption. One of them is going to be the loser, so don't chance it. Take your calcium about 2 to 3 hours away from your iron to make sure that both of those vitamins get absorbed well. Another thing is not getting labs done. When you're a fresh post-op patient, you're getting labs all the time. You're getting labs while you're in the hospital. You're getting labs at your 3-month follow-up, your 6-month follow-up, your 9-month follow-up, and so on. But what you have to understand is for the rest of your life, you need specialized lab work. This is not your typical yearly lab work that your PCP does. This is looking at specific things to bariatric patients, and that is a lifelong minimum yearly commitment. So, Bariatric surgery is a lifelong alteration in our anatomy, and it requires a lifelong commitment to taking your vitamins every day, not just when it's convenient, and to getting those labs done. Finally, another thing that I see commonly is not paying attention to B12 or taking it incorrectly. B12 has to be taken in a special way, and B12 deficiencies in bariatric patients are common. B12 does not absorb well when taken orally, so it needs to be taken sublingually via injection or via nose spray. So sometimes we see people take B12 as part of a regular multi, and in reality, it's not getting absorbed. So be sure, whatever your bariatric team told you about B12, be sure to do it that way. And oftentimes that's in a prescription form. So it's easy, folks. I know that we fought very hard to get this surgery and to be healthier afterwards. So we need to be sure to do what we can to stay healthy and to make sure vitamins, they're insurance, and they're especially important insurance for those of us in the bariatric community. If you have any questions, I'd love to hear them. I'd love to hear where you're at in your journey. If you have any video ideas, please drop them below. I hope everybody has a great week, and we will see you next Wednesday. Bye.